US troops at the end of August. The Taliban says the discussions went well, with Washington freeing up humanitarian aid for the country. However, the US team's statement was less definitive, saying only that the two sides discussed provision of robust humanitarian assistance directly to the Afghan people. The US also added the current talks being in no way a preamble to recognition of the Taliban. I'm Charles de la Desma.
And I'm Rita Foley, AP News.
This is 8:20 a.m. WCPT Willow Springs and streaming worldwide at WCPT820.com. We are Chicago's progressive talk, where facts matter. Now, your WCPT 820 Chicago traffic update.
On the outbound Kennedy this morning, it remains closed between Bryn Mawr and Cumberland. That's closed due to an earlier crash. It's causing some solid delays back to the junction because of that, though. Also on the Dan Ryan, if you're heading inbound, that's sluggish between Cermak and Roosevelt with the express
Happy Indigenous Peoples Day.
35th into the Stevenson as well. That ramp from the inbound Stevenson to the inbound Dan Ryan, it's a little sluggish as well this morning. Also on 55,
we're going to be talking about that today. There's a real fight over Indigenous Peoples Day.
That left lane continues to be blocked in that area. And on the tri-state, if you're heading southbound between 75th and Archer, they have that long-term road construction in place, and that continues until next year. That's traffic. I'm Paul Bowden-Loss.
Remember when you get to work to hop over to WCPT820.com or the TuneIn Radio app and stream The Stephanie Miller Show. Weekdays 8 to 11 a.m. on Chicago's Progressive Talk, where facts matter.
Diabetes, high blood pressure, anxiety meds, everyone's on them. If you're a 50-year-old male, maybe a bit porky, and you may even have type 2 diabetes, $1 million of term insurance may only cost you about $200 a month. Call Term Provider. Speak with Big Lou at 800-590-7516. Big Lou will find a term life policy for if you have type 2 diabetes, are overweight, or have high blood pressure. Term Providers help thousands of people like you who think they can't afford term life insurance. To buy $1 million of affordable term life for you, all you need to do is call Big Lou at 800-590-7516. Lou will make sure the scales are tipped in your favor. Call
60 seconds.
Okay, thank
516. Big Lou will answer your call and work to fit you into a term life policy that you can afford. Remember, Big Lou's like you. He's on meds too. Call 800-590-7516. 800-590-7516.
You're listening to WCPT 820 because facts matter.
Host of the Consumer Guide Car Stuff podcast. Join us Sundays at 1 p.m.
Hey, everybody. How you doing today? We're going to be talking about Indigenous Peoples Day. And, you know, Devin, if you can't get Dr. Verholden readily, please get Dr. Knighton, okay?
Okay, we'll do.
And we'll just keep trying. Thank you so much.
Consumer Guide Car Stuff podcast Sundays at 1 p.m. right here on WCPT AM 820.
This is the Santita Jackson Show.
Determined, unstoppable, achieving the impossible. We're standing tall with our heads held high. We are victorious.
Hey, everybody. Welcome to the Santita Jackson Show, Monday, October 11th, 2021. Happy Indigenous Peoples Day. It is now a federal holiday as dictated by the president, as deemed by the president, by President Joe Biden, first president to do so, just this past Friday. It's also Columbus Day, so we're going to be talking about that in the second hour with Illinois Cook County Commissioner Brandon Johnson, who has his own show here on WCPT at 9 a.m. on Sundays. He has wanted to have that officially acknowledged here, and he's getting pushback. A lot of people are getting pushback, and then a lot of people are very supportive. So I want to know what your thoughts are about Indigenous Peoples Day. Should we have Indigenous Peoples Day only, or should it replace Columbus Day? Remember, Christopher Columbus never got to what would become the United States. He got to the Caribbean. Hispaniola, which is Haiti and the Dominican Republic. That's where he was. And I want to know what your thoughts are about this. I mean, a lot of people have a lot of thoughts. The Italian American community has a lot of thoughts, even though Italy, as we know it, did not come into being into the 1870s. He was from Genoa, but his ashes were taken to several places because his son Diego felt that he belonged to several places. Remember, he was sent to the Americas by the Spanish Queen Isabella on an exploration, also known as piracy. That's what he was here for, looking for riches in the New World where people lived. So we want to talk about that today. And of course, we'll be getting the latest and the greatest on COVID-19 because everything continues to evolve. And one of the things that I've learned from my dad is that even though it might sound like you're being repetitious, he said, actually you are, that you have to approach people, particularly with fresh information, as if they're just hearing it for the first time. So I want to know what your thoughts are about boosters, about mask protocols, about safety protocols. I'm seeing a lot of people who are not doing that. I mean, and I am like masked up when I see my parents. I mean, masked up, masked up. I mean, my mother and I were putting on masks. I was eating with her yesterday, but as soon as I finished eating, I put the mask back on, and then you go wash your hands, blah, 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 all of that. So everybody, thank you, Michael Ann. Please, we're coming to you from WCPT, the nation's largest progressive talk radio station, where you get some of the best talk in the world. Joni Esposito, my colleague in the afternoon, but of course we've got Stephanie Miller and Tom Hartman and so many wonderful people. Keep it locked right here for the best progressive talk in the United States, right here on WCPT and AM 950 radio. My brothers and sisters to the north in Minneapolis, St. Paul, I want to hear your voices today. Call me at 773-763-9278. 773-763-9278. Lorraine and Paula, if you would put that up for me, and Michael Ann, my original morning stars, that would be so helpful. 773-763-WCPT. And please go on over to YouTube. Hey, Paula, please, everybody, go on over to YouTube. We've been told that that's really where we ought to be, that Facebook should be our portal. So please get over to YouTube to the Santita Jackson Show. Please, 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 please. Daryl and Lester and Carol, not me. Saskin out there on the left coast and Dave up there in Canada. And Raphael down there in Brazil, sending you all much, 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 much love today. Got a lot to talk about. And in Brazil, let me know, Raphael, what you think about Indigenous Peoples Day, because all of us in the Americas, this impacts all of us, because we're all over here on a European colonial project, an experiment. So what do you think about that? Do you think that this should be replaced? I mean, boy, there's some pushback, and I want to know what your thoughts are about this. So let's get to some of these headlines so that we can get on with the rest of the Santita Jackson Show. If you want to text me at 763 WCPT, GWC Injury Lawyers gives you the opportunity to do that. And I want you to meet me over on YouTube, Melissa and Lorraine, everybody. Thank you, Lorraine. Thank you. All right, everybody. Chicago, scattered thunderstorms, but a high of 77 degrees. Minneapolis, St. Paul, little cooler, 68 degrees, mostly cloudy. Major League Baseball, well, it's playoff season, and wow, the White Sox had quite the day yesterday. The White Sox 12, the Astros 6. And then in in the NFL, getting it all confused, everybody. The Bears 20, wow. The Raiders 9, the Vikings 19, the Lions 17. What a day, what a day. And then a squeaker with the Bulls, everybody. The Bulls 102, the Cavaliers 101. But I'll take the win, everybody. And then the Timberwolves will be facing off against the Clippers later on this evening. Merck has applied for emergency approval for what would be the first pill to treat COVID, everybody. What do you think about that? Is that exciting to you? Well, we're going to talk with Dr. Jennifer Holden about that a little bit later. While what is happening with Southwest, more than 800 flights were canceled on Saturday. More than 1,000 flights were canceled yesterday. Now, the Southwest Airlines Pilots Association, filing on Friday, asked to have the vaccine mandate lifted. Now, officially, they are not striking. It is not legal for them to do so. But what do you think is happening, everybody? It is tying up traffic all over the country. 1,800 flights in 2 days. And it is continuing, everybody. In the meantime, we're seeing hundreds of thousands of U.S. troops who have yet to comply with the vaccine mandate. What will all of this mean, everybody? This is according to reporting from the Washington Post. What do you think about that? How is this going to go? Because we're seeing now hundreds of thousands, at least, if not millions of Americans who are refusing to comply. What do you think about that? This report from Common Dreams, as Americans demand tax reforms, there is analysis that shows that the top 1%, get this everybody, hold more wealth than the whole middle class, everybody. By comparison, in 1990, the top 1% held just 17% of the nation's wealth. That's still a lot. But as this is there's the bombshell Pandora Papers, we talked about this last week with the man who did the revealing, Chuck Collins, as they continue to expose dubious details about the wealth of the super rich, who are also the super powerful. Most of them are heads of state. Bloomberg on Friday published this analysis of the U.S. Federal Reserve data revealing that Americans in the top 1% income tier now have more wealth than the entire middle class. How does that make you feel? What do you think about that, everybody? Call me at 773-763-9278, 773-763 WCPT. Well, just as quickly as it was established, well, now the appeals court has now reinstated the Texas abortion ban. Reproductive rights advocates lashed out overnight on Saturday, following a ruling by the Fifth Circuit Court of Appeals, which reinstated a near total ban on abortion in Texas, just days after a separate federal court had placed the state's law on hold, pending final judicial review. It looks like it's heading to the Supreme Court, everybody, the U.S. Supreme Court. There's a jobs report that confirms that ending unemployment aid for 8 million people was a complete disaster, everybody. The latest federal data, according to Detroit Congresswoman Rashida Tlaib, should put an end to the false myth, she said, that unemployment insurance benefits keep people from working. 194,000 jobs, everybody, is equal to less than 3% of the people who were removed from the unemployment rolls in September, everybody. We are really having a tough time. What do you think about Indigenous Peoples Day, everybody? What do you think about it? Is it Indigenous Peoples Day? Is it Columbus Day? Should we share?
Reverend
You
Yuri
tell me.
Gonzalez.
Reverend Dr. Yeri, I need some good news today. How are you doing?
I'm well this morning. How are you, Santita?
I'm doing great on this Indigenous Peoples Day.
Well, happy Indigenous Peoples Day to everybody. I hope everybody is well and off to a great start for the week. I want to give you a little something to get going for the beginning of the week, so let's go ahead and go for it. Good morning, Chicago. Good morning, Twin Cities, Minneapolis, St. Paul. Come on, let's get going. Let's get moving. It's time to get with it because it is Monday. You're alive. Put your feet on the floor. Feel the coolness of the towel. Come back. Let you know. You're here, you're ready, you're going. Take a deep breath of life, get that morning beverage going, that morning Joe, that hot tea, that fun, because we've got to get to it. Want to inspire you, hopefully, with a little bit of good news this morning. I want to talk to you about framing. The reason I want to talk to you about framing is because how we frame an issue helps us how we see what's inside it. Now, Santita, sometimes I like to get pieces of art, and I don't always get them pre-framed. But when I get them, I look at what I want to put around the thing to determine how I want to be able to see the thing, what's in the frame. Because what's in the frame is the important piece, but the frame helps us to really kind of see a little clearer what's in the middle. Now, the reason I'm starting there is because you and I, carry around within us all of the evidence we will ever need that God does really awesome things. We carry it around in our bodies. And it's a detail that we often miss because we're so busy trying to, do what we do until we sometimes just overlook what it is that we actually have within us. So here's what I would say as we get started, that in you is this beautiful print, if you will. The fingerprint of God is on your very design, but how you frame it will often adjust or affect how you see it, how you see yourself, how I see myself. And so what we have to do is we have to keep in mind the value of what we're putting in the frame before we surround it by something that alters how we see it. What am I saying? Well, when we get up and we get started in the morning, the first thing we often do is we run and we look in the mirror. Yeah, we look in the mirror. I got to admit, I do it. But the thing we often do is we pay attention as we're looking at our reflection. The first thing we notice are the blemishes. Well, rather than notice the blemishes, the flaws, the difficulties, we have to take a look at the whole image. And if we're focused only on the blemish and we frame how we see ourselves around the flaw, then often we'll see ourselves as imperfect. I get it. We don't all have it all together. We got some things we got to work on, but I want to tell you something. You're beautiful, you're bad, you're awesome. You got a whole lot going on. And as you look at your frame, look in the mirror this morning, you will see that as you frame yourself as being created by God that loves you so much to make you unique, you can then say, I'm created intentionally. So here's what I want to say to you. God created you by a design, so much so, Santita, you and I, we're a lot alike, they say, as a human species. We're 99+% alike. But there's just enough different about each and every one of us that we are unique, and it's our uniqueness that gives us a sense of an independent purpose to change the world. And so as you and I go about what we do, it helps us to know that we have connections, but we have uniqueness that allows us to see ourselves in a way that gives us value. And so I want you to look at your reflection. Pay attention to the details. Look at the color and texture of your hair, the color of your eyes, the smoothness of your skin. If you've lived a while, look at how your face may show the signs of persistence and resilience, but recognize that in you is all of the evidence that you will ever need, and God has created you to go change the world. So as you frame your sense of who you are this morning, recognize that you are bad somebody because God created you on purpose and without apology. Now, here's one last thing, and then I'll let you run. Remember that things that are rare and of high value, it's hard to put a number on their worth, on its worth. And so I want to say to you, you are a rare find. You're one of a kind. There's only one of you, not another one to be found anywhere. And guess what? You can do what no one else can do, and that's to be the best you that you can be. So your assignment today is to frame your understanding of who you are and go be the best you that you can be. Why? Because you're priceless, not worthless. So go ahead and put the best value of who you are out there. And remember, how you see yourself, how you frame your image is going to have everything to do with how folks see you and how you see yourself. You're beautiful, you're bad, you're bodacious. Go change the world and have a great day. I can't wait to hear what you do.
Amen to that. I love it. The frame. Boy, perspective matters, everybody. Focusing on the flaw, you will miss your blessing. You sure will. Pastor Todd Yeary, Vice President of Rainbow Push, but he's the senior pastor of the iconic Douglas Memorial Community Church in Baltimore, Maryland. It's one of the iconic Black churches in the United States of America, and he's doing such a magnificent job. I don't know how he does all the things that he does because he's also a lawyer. I just don't know how he does it. But God gives him energy, and he's given him brilliance. And so we thank you for all that you do, Pastor Todd Yeary, Reverend Dr. Todd Yeary, Esquire, great learned man. Dr. Deborah Verholden, epidemiologist, one of the world's foremost epidemiologists, comes out of Johns Hopkins University. They brought her to the School of Medicine at Michigan State University because she's creating their School of Public Health. One of the world's foremost epidemiologists, the Associate Dean of Public Health at Michigan State University, Dr. Deborah Verholden, who is with us every morning. We're so privileged to have her, but with all of her great professional accomplishments. The greatest accomplishment that she has right now in her life will be in being India's grandma. So here we are. India's grandma. I'm serious. Everyone, we had a big Zoom call. She included me on with some of the great minds and in the field of epidemiology and science. She gets on the phone call holding her baby. I don't know. I said, this is rich. I love it. I love it. I love it. I love it. But this is so sweet. How is she doing? She looks like she's a toddler almost. She's only a month old. This is crazy. Beautiful, beautiful baby. You have to give us the picture so I can post. I don't post without permission. Because everybody,
you can absolutely post.
She belongs to everybody.
Yeah,
I just
can
want you to
post.
know that. Okay, everybody, I'm going to post very shortly. I'm going to post during the break. Let me ask you this. I have a lot of questions for you today, and I'm going to try and bring on Dr. Shanita Knighton, because you always kind of wrap me on the knuckles about being very specific, and I appreciate that, about infections and how we prevent them. But what about this pill, from Merck? Merck had moved out of the vaccine race, if you will, because they said, we can't find a vaccine that is up to our standards. So what we're going to do is focus on therapeutics. And so they've rolled out a therapeutic. We'd heard about something that they were going to roll out some months ago. But now they said on Monday, they submitted an application to the FDA, the Food and Drug Administration, to authorize what will be the first antiviral pill to treat COVID. Please explain what an antiviral pill will be, and should it, could it replace the vaccine, or can you take it once you've had the vaccine? Will it work if you haven't had the vaccine? I've got about 4 minutes, and they belong to you.
So I'm glad that they submitted for FDA authorization, and that's what we should all be waiting on. I personally don't like. I think it's, when they come out prematurely and they say this is effective or that's effective, I think companies should wait and let the FDA issue the authorization, because it can be very confusing for people. When the pharmaceutical companies came out and said, oh, we found that the vaccine was safe and effective for children, 5 to 11. We had all these people in the community showing up thinking they could get their 5 to 11-year-olds vaccinated. Well, they said it was safe. Yeah, but it hasn't been approved for use yet. And I just worry because all of this misinformation is hard for people to wade through. And I think for the people who are still grappling with some of these decisions, it's only adding to the confusion. So their antiviral pill won't replace the vaccine. The vaccine is really about prevention, and the goal is to prevent people from getting sick in the first place, and also to prevent people who get sick from being hospitalized and dying. What their pill does is it adds to that. It, based on what they've said so far, it reduces the symptoms that people have, and it'll reduce hospitalizations and risk of death. So to that end, it's a good thing, but it won't replace the vaccine. It'll be something, again, another now layer of protection. And then that Swiss cheese model of pandemic defense, that last layer, we've overemphasized vaccines. It's vaccines and therapeutics are that important layer. So this will be adding to that.
Okay.
But it won't replace the vaccine.
Well, let me then ask you this about equity. The report came out last week that this same company, it'll cost them about $17 to produce the pill, but they're going to sell the pill for more than $700, 40 times what it costs for them to develop it. 1 minute. What do you think about that? Is it necessary for it to cost that much, Dr. Verholden? $17 more than $700. Is that necessary?
Well, these companies, we already know they're in it for the money. What I find interesting is that a lot of our government tax dollars have helped to fund the research and have helped to fund these things. Yet we're just gonna be paying for it, many, many times over. This is where I think some good government intervention could likely be helpful. And you think about that, we're talking about nationally. Imagine on a global scale. Globally, that $700 is a lot of, that's the annual income for some people in other parts of the world. So,
And if you're not
global
insured,
stewardship, in my opinion.
well, you know, and
Yeah.
you're making the point. You've made the point that with a lot of people now who are unemployed for various and sundry reasons, a lot of it's attached to vaccine mandates, because our health insurance is tied to our employment. A lot of people will not be able to afford this, and so then it's going to be, you know, a matter of the haves and the have-nots. If you have, you'll be able to get this. If you don't have, you won't be able to. It's something to think about, everybody. When talking with Dr. Deborah Holden on this Indigenous Peoples Day, that's how I celebrate it. And that is no disrespect to anyone. As Donny Hathaway sang, and to be young, gifted, and black, I'm not trying to down anybody else. But you can't discover a place where people already live. Okay? And the only way we're going to get this project right is to get it right and to tell the real story. But it's officially Indigenous Peoples Day and Columbus Day. So let me know what your thoughts are. Not gonna give you a hard time about it. I just want to hear your thinking. More of the Santita Jackson Show in just a few minutes. Carol Soskin said, "Thank you, Dr. Deb the Great." And you know you are Paula Garcini Zipser's girl. And you are the glamour. That's how I'm telling you, that's what they call you now. You're glamour. Glamour. I love it. And I'm going to ask you something about Dave Dowling. Feels that children should not be getting these vaccines. Because are we still in a clinical trial, Dr. Furholden? She has me on mute because she doesn't want me to hear the background. Dr. Deb?
I'm not on mute. Can you hear me?
No.
I'm here.
Okay. Well, let me ask you.
Can you hear me?
Yeah, no, not at all. I couldn't hear a thing. I thought you put me on mute. That's all. It's okay.
No.
But you know, I should ask you this question during the show itself, because I want you to speak to this, because now, you know, vaccines are more and more accessible to children, but even though the FDA is authorizing emergency use, is that still a clinical trial?
No. So the clinical trial, those clinical trials have various phases.
Sending Dr. Knighton through.
Various, you know, the testing protocols, right? First, they just get general safety, then they start to refine dose and other things, and then they need a larger scale sample to, you know, establish efficacy, right? How well it worked under these ideal conditions. And so they're still doing that work, but that's not what emergency use means. Emergency use it's a different level of regulatory control. It means they haven't hit the bar to have substantial evidence of its effectiveness. And that's sort of like a numbers and a time game, right? But it has hit a bar of regulatory approval, but it hasn't hit the bar of substantial evidence of its effectiveness. That just takes time.
Okay.
That takes time.
But see, you know, and that's why
you would issue emergency use if you're in emergency. If you're in a state of emergency and you need the medication, you don't want to hold the medication back for time, because in the meantime, people die.
Hey, look, I told you, if people tell me what the deal is actually, then I can handle it. You know, the life-saving surgery that I had in 2004 is technically experimental even today. But my doctors were very honest. They had performed this surgery, you know, countless times, not many times, but it's a regular procedure outside of the United States. It's called the biliopancreatic bypass. And so I felt comfortable because the surgeon that I had also pioneered it laparoscopically. So it was not an open surgery. I'll talk to you all about it one day. But there's so much in this process that has not been, people have not been forthcoming. And that has made everybody, you know, not a little, but a lot uncomfortable. And so I thank you every day. And of course, we've got your girl, Dr. Shanina Knighton, with us
60
today.
seconds.
Dr. Knighton, how are you?
I'm fine. How are you?
Girl, you sound like such a school marm. We love you. we love you. We love you. But I want you to go to that point, Dr. Verholden, when we get back, okay?
Sure.
Paula, why don't you call in? Because I would love to hear your thoughts. Because I know that the Italian American community, not all, but no group is monolithic, but some people are feeling some kind of way about this, and I'd like to hear your thoughts. I really, really would. I really, really, really would. And no judgment, even though, for me it is Indigenous Peoples Day. But I think we do need to know the story of Columbus and really need to know what he
10
did
seconds.
and know why, Indigenous people say, we can't celebrate and honor him. Plus, he never even got here. Never even got to what would become the United States. He didn't discover this, everybody. People were already here, and plus he never got here.
This is the Santita Jackson Show.
Determined, unstoppable, achieving the impossible. We're standing tall with our heads held high. We are victorious.
Hey, everybody. Happy Indigenous Peoples Day. For some people, it's still Columbus Day, but actually, officially, it is both days. This is a shared holiday with the Indigenous people and Christopher Columbus. What do you think about that? 773-763-9278. 773-763 WCPT. I want to hear your thoughts and I want to see what you're saying. Of course, you can text me, thanks to GWC Injury Lawyers, to the number where you can call me, 773-763-9278, 773-763-9278. We're talking with Dr. Deborah Verholden. We've been joined by Dr. Shanina Knighton, research clinical scholar at Case Western Reserve University, registered nurse, and infection preventionist extraordinaire. I love following her on Instagram, Dr. Nina.preventionist. Dr. Nina.preventionist. Dr. Deb, she's always telling us something that makes me go, ooh, did I do that? Oh. So now I'm carrying around a toothbrush, okay? A toothbrush dedicated, as she said, to the sole purpose of cleaning under my nails. Hello. Because, that's important, everybody. You got to clean up under these nails. Like get something that's going to remove the debris. Yuck. I'm like, I can't even stand myself, Dr. Nina. But let me go back to you, Dr. Deb, because we were talking just about whether this Merck therapeutic, if it's experimental and if we're in a clinical trial, particularly Dave Dowling said, hey, I don't think children should receive these shots because this is experimental. Why don't you speak to that, Dr. Deb?
Well, those are 2 points. So the Merck drug, it offers some promise. Like I tell people, let's wait and see what the FDA says. Let's see if they issue the emergency use authorization. Let's see how much it costs and how much you will have to pay for it with and without insurance. But it's not in lieu of the vaccine. It's in addition to, this is adding another layer of protection for people who are infected to reduce symptom severity. As far as children being vaccinated, parents have to make that decision for themselves. I would go with whatever the FDA recommendation, what the FDA approval is, and the recommendation of my pediatrician. That would be my decision-making process. I wouldn't even consider it until the FDA said, authorize its use, and then that would be a conversation that I would have with my pediatrician. And that's all that's what I can offer people. This is not I don't think anybody would come on and give people medical advice, but I think most of us in the health space would say, these are things you work out with your care provider. And for your children, that should be your pediatrician. And it's unfortunate because one of the things that we know happens is kids missed a lot of their vaccines during COVID. And kids missed a lot of child visits during COVID. That's my recommendation for folks. First follow the FDA. Don't even consider things that aren't FDA approved. And then second, work that through with your healthcare provider.
What happens if your healthcare provider thinks that maybe these vaccines might not work for your children? I mean, because we're now running up against mandates, even for the children. How do you square that? How do you work through that, Dr. Deb?
Well, ultimately, at the end of the day, I always tell people, you're the captain of your own health team. and parents are the captain of their children's health team, right? So the medical professional is a important member of the team, but you are in charge of that, But I think, you should have a relationship with your healthcare provider that's built on time and integrity and transparency and trust, And so what's the point of having a healthcare provider if you don't trust the advice that they're giving you? So maybe it's time for people to true up to that and get a healthcare provider that works for them. I remember making the choice about pediatricians for my children, and it was easy for me. I ended up, my husband's pediatrician was still practicing. My ex-husband was his first year of practice. And so I got to, have a pediatrician that we really trusted and really knew, because he had been that for my, kid's dad. And then when he retired, we had to, interview and start the process to find a different pediatrician. And so I don't take it lightly because I'm not a medical doctor. And even medical doctors, don't treat their own kids. And so it's important that you have somebody that you trust, that you have somebody that is up on what's happening, that's current and relevant, that is, staying abreast of what's needed to provide the best care for their patients, and in this case, your children. But the whole point in having a physician is that you have somebody to go to help figure these issues out with.
I want to thank everybody, all my morning stars. You all are switching over to YouTube. Thank you so much for that. Thank you. And please like and subscribe and tell everybody else to please like and subscribe and go over to the Santita Jackson Show. That's where they really want us to meet nowadays. Thank you so much for making the switch. For those of you who can, because Carol is trying to work out something with her phone, and so I appreciate that. But thank you all for tuning in. It means so much. Please like and share if you're on YouTube, and like and subscribe if you are, if you are on Facebook, and like and subscribe if you are on the Santita Jackson Show YouTube channel. Dr. Shanina Knighton, registered nurse and infection preventionist, research scholar. You bring some of the best people to us, Dr. Deb. This is the headline. Even after mild COVID-19 infection, antibodies protect from reinfection for up to 6 months. What does that mean? And does that mean that you can be unmasked once you've had COVID and if you've been vaccinated, or if you just had COVID and you've got all these antibodies? What does that mean?
I still know that we are in a pandemic. So that's one. And yes, while there is some protection that is provided, just as we're learning and just like we know, there are different strains of COVID that exist. So you may have some protection and have some built-up immunity potentially for the strain that you have encountered. But as this pandemic, or I would say as COVID is evolving, and whether we're going through a Delta, Gamma, a Columbia strain, however they choose to classify it nowadays, according to the media, quote unquote, you want to make sure that you're still protected at all times. So, for example, if yes, I just recently, had COVID, I'm done shedding the virus, I have antibodies built up, but I'm saying, hey, I want to go around crowds of people. I still would caution people to still make sure that they're protecting themselves until we know that we're out of this stage of being inside of a pandemic. Meaning, for example, if you know that you are going to go to, let's say, some large event, we know that when they created the vaccine and they went through clinical trials, the vaccine that's still being pushed right now is still the vaccine that was created last March or started going through clinical trials last March. These strains are still evolving. Just like we have with flu, there is still a potential of breakthrough. We still have flu, and there's an influx of that this year. We're talking about RSV. So there are still other reasons for us to take protective measures that would justify to me why we should still want to wear a mask. In areas where we can't properly social distance, or areas where you just are unsure of people's status, or the air quality. So that would just be me personally. I know some individuals, it's like, oh, well, I had it and I can't get it again. That very well may be the case, but I caution people, just because you cannot, let's say systematically you won't be as ill, it still doesn't mean that you can't transmit it to others. And I'm still seeing individuals, let's say, they'll pull their mask down so the mask is not covering their nose, and they're still picking with their nose. I actually encountered that recently when I had to go return some gloves to my son. And I was like, well, what's the purpose of having a mask on if the mask is going to be beneath your nose and still messing with your nose?
Please explain. Because, I can't have a fight anymore with people who've been vaccinated. And when I ask them to lift up their mask, or if I ask them, if they're in my personal space, where is your mask? It's like I'm being made to be the bad guy, Dr. Knighton and Dr. Verholden. I mean, and it's just sowing the seeds of so much interpersonal conflict in the United States because, and let me switch this back to you, Dr. Deb. I mean, it seems like there is not, I'm wondering about the policy. Our authority figures need to speak with one voice, Dr. Deb, because everybody's got 50 million narratives, or in this case, 331 million narratives in the United States. Everybody's heard something different. I was telling a gentleman who was vaccinated, I saw him this past weekend, and I said, you do know you're supposed to wear a mask. We're sitting in the car. You have the windows up. We're sitting in the car. I'm like, are you kidding me? And he looked at me. He said, I had no idea. Dr. Deb, huh? What is missing? It seems like there's a disconnect. Are people listening? I mean, what information? Folks ain't getting it, Dr. Deb. What should you do?
Well, some people have information and they just don't want to act on it. Some people are over all of it. They're just over it. And some people have already gotten to the point where they're like, I do think a lot of people have internalized that we are now just living with this thing, and they're figuring out what that looks like for them. This is going to be one of those real interesting times where, other people's rights will infringe on yours. Okay. So we know what it was like when you went into the store and then the people wouldn't honor the distance and you'd be in line and somebody would pull up right behind you, breathing down your neck with no mask on. We're just seeing more and more and more of that. So, and the vaccine narrative, I don't think is helping. I don't think it's helping to, keep blaming spread on the unvaccinated and trying to force people to get vaccinated as the cure for every problem that we have right now.
Well, it brings me to this issue.
Yeah.
No, it brings me to this because now we're beginning to see the problem that you and Dr. Knighton foresaw. And I'd love to get you to weigh in on all this, starting with you, Dr. Deb, because, you're in the public health space. You deal with policy. Southwest Airlines, one of my favorite airlines because I always get such great fares. On Saturday, 800 plus flights canceled. Yesterday, more than 1,000 flights. That's a lot of flights. People are stranded all over the place. And even though officially the pilots are not having a sick out, they're not on strike. Unofficially, there's a lot of speculation because they legally, they cannot do that. But they are filing papers to lift the vaccine mandate. And we're beginning to see people get fired and people push back. We're beginning to see this happen at other airlines, not to the same extent. What are we going to do? I mean, that's a lot of flights, Dr. Deb, not to mention the fact that I was supposed to be on Southwest on Friday. I have a wedding to go to. Oh, I'm trying to figure out, do I need to take the train?
If I were you, I would make alternative plans. We're going to see more and more of this. We're going to start to see lawsuits. We're going to see people, coming together, being a demand. We're going to see all of that. This is the problem when you sidestep the work of the good health education and health literacy campaigns that were needed from the second we were in a pandemic, and then we waited until we had a vaccine. Did a terrible, highly inequitable job of rolling that vaccine out, and then have just fumbled all of the messaging. around it ever since. And the very rare but important injuries that have happened have gotten a lot of attention, and have left people with more fear than confidence in many cases, more questions than answers. And so now you've got people, and look, this isn't, we're talking on pilots. These aren't, uneducated people just following the hype. These are people who have said we have rights and we don't want those rights taken away from us.
Well, I mean, the fact is the most vaccine hesitant are people like you, the PhDs. Those are the most vaccine hesitant. I mean, the studies show that. And and quite frankly, in corporate media, you do not hear about vaccine injuries. You hear about it. Well, you can't really hear about it on Facebook or other places. But now there's just a lot of chitter chatter. And that's why when you censor people, Dr. Deb, that becomes a problem. When you forbid certain conversations, that becomes a problem. Because then we can't discuss freely what's bothering us or what's on our minds. You understand what I'm saying?
Mm-hmm.
I mean,
yeah.
Because I can come to you and say the most outrageous thing that I've heard. I've come to you. We've talked about it. And I'm like, oh, okay, thank you. That's all it takes. Even if I give you pushback, you're like, but no, here is the data. That's what we don't have that atmosphere right now, Dr. Deb, and that's hurting everybody.
Mm-hmm.
It's just my thought. Just my thought. I mean, 1,800 flights in 2 days. Most people are squeezing these pennies trying to do anything. People spending the night in airports. Even Southwest staff, they don't have hotel rooms. This is insane. Dr. Shanita Knight.
And more cancellations coming today.
Oh man. Okay, I'm gonna have to come up with some different plans. And I called my mother yesterday because my family, we have to go to a wedding, and I said I don't think some of us are gonna be able to take Southwest. She said, "Ooh, well, I guess She said you're gonna have to come up with some alternative plans, baby. You might have to take the train, which I think I might have to do." Dr. Knighton, you said that you saw this coming. You saw this coming, but I have to tell you, I just said, I hear you, but 1,800 flights in 2 days, that's a lot.
Mm-hmm. You got to think about it, though. Even like right now with what's happening, I mean, I'm starting to see signs slowly turn around that says, okay, if you're vaccinated or unvaccinated, still wear a mask, right?
Mm-hmm.
But just as I mentioned before, we shouldn't have taken this long to be able to get here. And, for individuals that maybe even were following me back, I would say December. I created infographics for around the vaccine, even around December. And the message was it's still masked up even after vaccination. And I've had the same consistent message in regards to, yes, there is potential that you can still be infected after vaccination. And that is because even with the paperwork that was filed with the emergency use authorization, the purpose of the vaccines was to reduce clinically relevant symptoms and reduce death. The overall purpose was not necessarily to prevent transmission, and that has been the concern. We all know that viral shedding happens. So if someone was to inject, let's say, the flu vaccine or inject, the COVID vaccine into your arm, that is going to help you out. Excuse me. That's going to help you out systemically. That is not going to necessarily mean that the viral shedding that can occur between your mouth and your nose is going to stop. So there were measures that we were rolling back that we should have never been rolling back. We also became so singularly focused, and Dr. Deb mentioned this too, on the vaccine, that it was like, oh, now that we got the vaccine, they immediately started rolling back masks. They started rolling back environmental cleaning as if we knew this was going to be the end-all, be-all. And I believe in science. I believe in medicine to be able to usher us on, but the concern is when we start treating each individual entity like it's God and not realizing that these things need to be able to work together for our overall good and not just be singularly focused. So yes, when you are pushing the message of, oh no, you got to get vaccinated, oh, I'm going to give you $1 million or the chance at $1 million, or I'm going to give you the chance of free education if you go get vaccinated. That's the first message. And then you say, you know what? Okay, since our money initiative ain't work, now we just going to mandate it on your workplace and take your health care and take your food away too. So I'm just saying, like, that to me would raise a lot of skepticism for the public if that is how we're sending messages, which is honestly, I know for sure, not how a public health professional would have rolled out any education around this particular topic. So when we look up and we see what's going on right now, this is the result of poor leadership. And no, I'm not pointing the finger at any politician. This is just overall just bad leadership and us having a lack of structure when it comes down to emergency preparedness. And what's sad is we have the tools in the United States. We just chose not to utilize them and reinvent the wheel inefficiently, even though we have scientists that have been specifying in these areas for a long time. So, yes, the confusion is now when you're seeing people that don't want to wear masks, they have now been sold on the fact that the vaccine is the end-all, be-all, and that they are no longer contagious and that they no longer need it because instead of the media, and I'm saying like commercials is like get vaccinated. It doesn't say get vaccinated, still wear a mask and clean your hands. It says go get vaccinated so we can get back to our normal lives.
Yeah.
That is the messaging that's shared, and it is so wrong. It is completely unethical, and it's misleading the public. So I'm very disturbed at it, but unfortunately, there's little old me, who can continue to do what it is that I'm going to do, but I just don't think that the messaging has been right to begin with.
Dr. Deb, you are at the top of this pyramid for us. Give us the message. Got 3 minutes. Give us the message. What should we be doing? What is the Swiss cheese model? What about these new therapeutics that are very promising? What about natural immunity? What about wearing masks, whether you've been vaccinated or unvaccinated? Just what should we do? Where are we?
Prevention remains our best strategy. We must continue to practice prevention. And again, I've been telling people I don't need people to do the most, but I also don't want them to do the least. I remember earlier in the pandemic, people were saying, especially in Flint, it's rough. People were saying, I've washed my hands 30 times today. Well, that was doing the most. You didn't need to wash your hands 30 times, especially because you haven't been out of the house and no one has been in your house. So we have to just keep making sure that we've got good messaging that's good information for people. The problem is if you overtax people or people are doing the most, that becomes very hard to sustain. It becomes very hard to sustain. And oftentimes when people are doing too much, they actually can have the unintended negative consequence of putting themselves at unnecessary risk. So it's really about just what are those very basic things. It's the basic protocols that we've always talked about with the good hand hygiene, masking, and Dr. Knighton has done, I think, an outstanding job of really getting us to have heightened awareness around what proper masking looks like. Everything from putting it on and taking it off to how frequently it needs to be changed or cleaned or, not putting it down around your neck and things like that. So, just those very basic protocols. And then the distancing. Still do need to maintain that. And I'm telling you, as somebody who was on a flight this weekend, I wasn't on Southwest, I was on Delta. All the planes are at capacity now.
Oh, yeah.
Every seat on the flight that I was on was taken. I just thought, man, this was not worth it. I mean, to be honest, I had that conversation with myself. I said, this was not worth it. I said, if there's somebody right around me that is COVID positive, like it was just not worth it. So I did my little protocol before I got on the plane and kind of sanitized my nose. I was very, very, very mindful while I was on the plane and navigating through the airport. But at the end of the day, for me, I said it wasn't worth it. The trip that I took, it wasn't worth it. Mm-hmm. If I had to do over again, knowing what I would feel sitting on that plane, I wouldn't have gone.
Everybody, please take care of yourselves. Whether you're vaccinated or unvaccinated, you've got to take care of yourself. You still need to wear your mask. You still need to Practice great personal hygiene, hand hygiene. You still need to floss your teeth, keep your mouth clean. You still need to do all of those things. You have to. All of those things really do matter. We're being pushed to do something really good, which is to really take care of ourselves and to be in the best health possible. That having been said, you got to do the right things, everybody. And Dr. Deb, these people, all your colleagues, they got to come together with the right message, Dr. Deb, because this is a lot. I mean, it's just they've just switched up so much. And I know these are good people, but goodness gracious. I got one message coming from the CDC, people leaving the FDA and the World Health Organization, which is not a government organization. They jump in, and I'm like, come on, y'all. Would you please sing from the same sheet of music? Hey, everybody, let's talk about Indigenous Peoples Day, Columbus Day. Now it's a shared holiday. President Biden is the first president in history, the first American president to acknowledge Indigenous Peoples Day. What do you think about that? What do you think about that? Some groups, some Italian American groups are pushing back. They're like, no, wait a minute, don't eliminate Columbus Day and Indigenous Peoples Day. I don't know if I'm feeling that. What do you think about that? 773-763-9278. 773-763 WCPT. More of the Santita Jackson Show coming up with Commissioner Brandon Johnson and company in just a minute. Dr. Deb and Dr. Knighton.
Yes.
I love you all so much. I'm going to let you go because I need these 2 lines. But you all are the best.
You did that with the head tilt. I love y'all so much, but it's time to say goodbye.
It's time to say goodbye. So my board operators do not get upset. How about that? Yeah, but look, I was looking at these Southwest Air pilots. Boy, I said, wow. Dr. Deb and Dr. Shanina, you all said this. You all said the same thing. So today, I've got to call my father because a very, very close family friend. This guy's like family. He is family for us, really. He gets married on Saturday, and I called my mother yesterday. I said, "Hey, Mom, is Dad awake? Hey, let me look. We need to. We're all headed to the same place, and it's kind of out of the way because it's in Rhode Island. So it's not like you can catch a flight there every 5 minutes." And the easiest way to get there is Southwest. So my eyes went like, what? Who? Oh my gosh.
They better. People better start printing their tickets before they go, so they don't have to touch those touch screens at the kiosk. And then I also say, make sure you got hand sanitizer or some because right after they check your card at TSA, like they didn't check a lot of cards. Like by the time they didn't check your card, and they don't change them gloves, so you got all kinds of stuff on your card, and people don't clean them. So it's even all kinds of nasty things that can happen even before you make it on the plane. And that's the concerning part. So when people be like, oh, I got sick after I came back from out of town, it likely has something to do with like your protocols and stuff before you got on the plane.
Natalie and Laura, I am so sorry. I wasn't looking at my phone. That is how I find out who's calling in. Please call in tomorrow. We're going to talk more, Dr. Deb and Dr. Knighton, about vaccine hesitancy and vaccine confusion. Dr. Deb, not to compare, but, if we trust anyone to give us an overall and overarching message about this, we trust you. So we need you to help us work through this tomorrow. Because this is a big deal, because we're being inundated with a lot of stuff, right? We don't, I'm telling you, I got into it with somebody about wearing a mask. I was like, at least while we're in the car, open the windows, but you got to put on a mask. Goodness gracious. I know you've been vaccinated, and so what? Oh, yeah, that's the kind of weekend I had. How about that? I said, I don't care what you've had. I do not care. I said, I don't want COVID. I don't want it. How about that? So I'm going to let you go, ladies. Love you. Unless you want to weigh in on Native, Indigenous Peoples Day and Columbus Day. Okay. I heard dead silence. Okay. I love y'all.
I don't have anything scientific to add.
Girls, This woman's got more political opinions about everything. You talk about someone's going to jump through the phone and take you by the neck on politics. Girl, get out of here.
Signing Attorney Patillo, Brandon Johnson, Dwight McKean, Attorney Fancher through.
I mean, come on. Oh, I don't have an opinion. You got to be kidding me. Tell somebody else that gobbledygook. It ain't me. Got opinions about everything. And they are researched. So everybody call me at 773-763-9278. Commissioner Johnson?
Hey, good morning, Santita.
Good morning. You're sounding very nasal today. Attorney Patillo?
Yeah.
It's all right,
Good
sweetie.
morning.
How are you?
I'm well. How are you?
Great, great, great. Who else do I have? Do I have Dwight McKee?
Yes.
Oh, we're gonna have a barn burner today. But I'm gonna bring you up, Attorney Patillo, because I want you to talk about this Creating Opportunity Conference, if you don't mind. About 2 minutes, okay?
Of course, sounds good.
Okay, fantastic. And you'll do it tomorrow and the next day until we get right up to it. Okay. So everybody call in. Did Laura from Atlanta drop?
She's still here.
Okay, let me speak with Laura real quick. I have about a minute, right?
Yeah, minute and a half.
Minute and a half. Well, tell Laura I'm going to bring her up. And I'll let her give a comment, just before we get into the segment, okay?
Okay, let's start that. Got it.
Okay, thanks.
All right, 60 seconds.
Thank you.
This is the Santita Jackson Show.
Determined, unstoppable, achieving the impossible. We're standing tall with our heads held high. We are victorious.
Hey, everybody. Welcome to the Santita Jackson Show. It's Monday, October 11th, 2021. Happy Indigenous Peoples Day, or Happy Columbus Day, or actually both. They're both federal holidays. President Biden became the first president in American history to acknowledge Indigenous Peoples Day. So what do you think about that, everybody? Call me or text me at 773-763-WCPT. WCPT, the nation's largest progressive talk radio station, my home station here in Chicago, and AM 950 radio, the voice of progressive Minnesota, Illinois, Minnesota. Indigenous names, Chicago, Indigenous names. Think about that, everybody. Think about that today as we celebrate and honor the people who were here when the place was discovered. So many thoughts about that, everybody. Call me or text me at 773-763-9278, 773-763-WCPT. Of course, you can text me, thanks to GWC Injury Lawyers. I want to hear your thoughts today. I want to hear your voices. Laura, I'm going to come to you from Atlanta shortly so I can get to your thoughts on vaccines because I didn't get to you in the last half hour, but I want to hear your thoughts today, everybody. Let's get to some of these headlines. Call us and let's talk about Indigenous Peoples Day, Columbus Day. How are you feeling about it? Facts are important, but it's the feel that I want to know about. Chicago will have a high of 77 degrees, scattered thunderstorms. Minneapolis, St. Paul, 68 degrees, mostly cloudy. Lots of sports to report, everybody. Major League Baseball in the playoffs. The White Sox, well, they were triumphant over the Astros. White Sox 12, the Astros 6. The Bears were triumphant over the Raiders, 20-9, everybody. And the Vikings, well, they bested the Lions, 19-17. The Bulls, they were triumphant over the Cavaliers, 102-101. Hey, I'll take it, everybody. It's a point. And the Timberwolves will be playing the Clippers later on tonight, everybody. Indigenous Peoples Day or Columbus Day, depending upon where you are or where you are. We'll be talking about that today. The gubernatorial race in Virginia is tightening. Now, it is supposed to be a bellwether race. We're supposed to see maybe how the Democrats or Republicans will do in 2022. The former governor, who is now the Democratic nominee, Terry McAuliffe, recently said that President Joe Biden's political challenges are dragging down his election chances. What do you think about that? We will be talking about that race, everybody. Even after mild COVID-19 infection, antibodies protect reinfection for up to 6 months, according to this study. 1,800 flights canceled in 2 days by Southwest Airlines. That's right. The Southwest Airlines Pilots Association filed on Friday asking for an immediate cessation. They want a hearing on the request before a federal court in Dallas, claiming that the carrier has continued to take unilateral actions that violate the terms of the Railway Labor Act, which governs airline union relations. They want the vaccine mandate lifted. And lots of folk do, and we're beginning to see this roll over to other airlines. Maybe not to this extent, at least maybe not now, but we're going to see a lot more of it as Americans are demanding tax reforms. Analysis is finding that the top 1% in the United States hold more wealth than the whole middle class, according to this Bloomberg report. The middle 60% of U.S. households by income, a measure economists often use as a definition of the middle class, saw their combined assets drop 26.6%. Wow, of national wealth in June. For the first time, the super rich had a bigger share at 27%, everybody. We need some opportunity. We need a way to get up out of this. There is $5 million in that $3.5 trillion reconciliation package for those who are coming out of prison if they want to become entrepreneurs. People looking for opportunities. Well, Rainbow Push is going to have a virtual and free Creating Opportunity Summit. Of course, one of our favorites here on the Santita Jackson Show, who has his own show on the iconic WAOK radio station down in Atlanta, attorney Robert Patillo, from 1 to 4 every Sunday. He is the Southeastern Regional Director for Rainbow Push, and he has been pulling together this conference. It's going to be fantastic. Robert Patillo, what's happening on October 14th and 15th?
Thank you so much, Santita. It's interesting to talk about these Southwest flights getting canceled. I was on one of those flights, so Midway Airport Saturday was an absolute maelstrom. But I do want people to understand that part of the reason for this that people think is misinformation on the vaccine, and we'll be talking about that at the Creating Opportunity Conference this Thursday and Friday, October 14th and 15th, starting with a tribute to Reverend Jackson at 9:30 a.m. on October 14th. People can register at creatingopportunityconference.com. We'll have a performance from Saban Music Group recording artist Nakia Gold for the song called Justice, dedicated to Reverend Jackson. We'll also have a special presentation from the U.S. Secretary of Agriculture, Tom Vilsack, addressing Black farmers. We'll have a Women in Leadership Roundtable panel, international session discussing issues affecting the African diaspora, particularly on the continent of Africa. We'll have a Youth Entrepreneur Roundtable on Friday afternoon. We'll have entrepreneurs, people who started businesses from the ages of 6 to 17. We'll be connecting them with business leaders so they can learn how to grow and prosper in business, and also to inspire more young people to get started in entrepreneurship earlier, and grow those as they grow and learn, and develop those into industries. So there, you can find a full rundown of the conference schedule at creatingopportunityconference.com. It's completely free this year. It is completely virtual this year, so you can tune in from your phone or from your car or wherever your mobile device is. And of course, we'll be celebrating Reverend Jackson's 80th year of life and 65 years of service to the civil rights community, and honoring him throughout with special cameos and birthday wishes throughout the conference. I want everybody to get signed up. Well, again, it's 100% free, so you can sign up at creatingopportunityconference.com. I think it's going to be a blast this year, so we're hoping to see everybody there.
And it's free, everybody, and it's free. You're going to get some of the greatest information without having to pay for it. But we do want you to join Rainbow Push. Please go to rainbowpush.org. And Reverend Jackson said, if you do anything for me for my birthday, please do that. It's not much to join Rainbow Push, and we'd love to have you be a part of the organization. Always, always, always. Everybody, Indigenous Peoples Day. Indigenous Peoples Day. What is it? And why is it so important that it's being established? Indeed, President Joe Biden is the first American president to establish Indigenous Peoples Day, in which we acknowledge the pain of Indigenous people and we celebrate their accomplishments. We're doing all of that. Now, that is running up against Columbus Day. The man who we were told in school discovered America, discovered a land that was already inhabited by its inhabitants, by Indigenous people. And he never even got to the United States, everybody, to the land that would become the United States. He didn't even get to Florida. He went to Hispaniola. He was in the Caribbean. And oh my goodness, what a tale. So many people were killed and enslaved. It was really a very, very ugly period in human history. He was sent into this part of the world by Queen Isabella. He got a little lost. Yeah, that too. Queen Isabella of Spain. And these kings and queens would always send their explorers, also known as pirates, out on expeditions looking for wealth. That's what this is. So what do you think about this? Because the people are trying to remove Christopher Columbus statues. The Italian-American community, many of them feel affronted. And so wherever you are on this, I want to hear from you. I want to hear your thoughts, because I think we really, really, really need to talk about this. We really, really, really need to talk about this, because this is part of the American dilemma. And when I say America, I mean in the Americas. Because from the northern to the southernmost part of this hemisphere, this has been a European colonial project, and people are feeling some kind of way about it. So let's talk about this. 773-763-9278, 773-763-9278. But very quickly, let me go to you, Laura, from Atlanta. Laura, who is down in Atlanta, where we're having our conference. Laura, what's on your mind, sweetie?
Hey, Miss Santita, how you doing today?
I'm doing great. I'm moving kind of quickly, but I did want to acknowledge that you called.
Oh, I'm sorry. I know you're on a different topic at this point.
Yes.
But I want to let you know that we've had issues here in Atlanta about, the vaccine and whatnot for people to be, vaccinated, and, they've mandated it and everything.
Mm-hmm.
Well, I've had a problem with MARTA this morning, which is
your transportation.
MARTA, Yes. Well, I got to tell you, they had drivers walk off MARTA because some of them don't want to take the vaccine, and there have been a lot of people who passed away with COVID sometime between last year and this year, and I got to tell you, I had to walk to work this morning. I had to walk from a friend's house and whatnot because the bus I normally would take had stopped running.
So you're now beginning to see, workers walk off the job, like we're seeing the pilots, right?
Yes, ma'am.
Hmm.
And that is the craziest part. And see, I know it's happening all over the country, and I understand it could be a religious thing or a political thing, but this COVID is making it hard for a lot of people here, especially here in Atlanta.
I think it's COVID and the mandates, right? And you know what, Laura, can you call in tomorrow?
I most definitely can.
Because, call in tomorrow, because I think a lot of people are feeling some kind of way about this, because now we're all beginning to feel it, right? And so, do you have any thoughts on Indigenous Peoples Day and Columbus Day?
You know what? I have heard stories on Columbus Day when I was growing up as a kid.
Mm-hmm.
You know, this is more like America being reinvented through history. Now that we know that there have been a lot of black and brown people in this country before even Columbus set foot in this country, that he so-called discovered it.
Well,
because,
you know he never got here, right?
Right.
You know,
I was told that as well.
Yeah.
He never did make it here.
Never, not even to Florida. Well, Laura, I'm going to send you so much love, but stick around. I'm going to have to let you go, but I want you to hear some of this information because I have a tremendous panel. Dwight McKee, Dr. D, social scientist, founding member of Rainbow Push and the National Action Network. And we have got Robert Patillo. Cannot wait to hear him break all of this down. Attorney Robert Patillo, who we just heard from Rainbow Push. He's a Southeastern Regional Director, brilliant radio talk show host and civil rights lawyer. Of course, WAOK every Sunday from 1 to 4 Eastern Standard Time. Let me start with you, Commissioner Brandon Johnson, who is my brother here at WCPT. Of course, every Sunday at 9 a.m. He has a wonderful show. And of course, it is his own show. And he, of course, is Cook County Commissioner Brandon Johnson, who right here, you felt that it was important. And you are a teacher, you are a husband, you are a parent, and you teach history. Why is it important for us to acknowledge Indigenous Peoples Day? And should we have Indigenous Peoples Day instead of Columbus Day, or should we do what the president has done? We're having two holidays on the same day. Can the twain meet?
Yeah, good morning, Santita. And I'll do my best, even as a social studies teacher this morning. I'm going to yield to Robert and Dr. McGee. But what I will say, briefly, is that, I introduced the resolution a little bit over a year ago. We've been working on this process on the Cook County Board of Commissioners to celebrate Indigenous people. And for me, it's actually quite simple. Last year, the county board, we celebrated, and one of the largest bodies of government instituted Juneteenth as a paid county holiday. And of course, eventually the state did it, and other places around the country are doing it. I just find it absolutely ridiculous and contradictory, the fact that we are celebrating Juneteenth, the emancipation, or the day in which the rest of our brothers and sisters got word that we were emancipated, and just a few months later, we are giving people a paid day off to stay at home in honor of one of the most horrific moments, I think, or institutions in the Western Hemisphere. Of course, that was moved by Christopher Columbus. And so for me, it's actually quite simple for all of the folks who have been impacted by the European nations at the time, that their main goal was to conquer the West, right? And in the midst of that, the gold that they found was black and brown, and that was free labor, the absolute annihilation and the genocide of our indigenous brothers and sisters, as Dr. King has referred to it as the original sin of America. That there's no reason for us to be celebrating that individual. And so it's unfortunate, though, that our body of government took a pass on it. But there are people here in Cook County that are very much determined to institute what we are calling Indigenous Reconciliation Day. So Indigenous Peoples Day, Reconciliation Day. And the whole point of the day is, as you indicated, Santita, is for the Cook County government to stop, slow down, recognize and honor the brothers and sisters who lived on this land well before it was so-called discovered, right, which we know the phallus there, but also recognizing that there are other groups who've experienced that same level of pain and forms of discrimination. So we see it as a way to draw people together. There are a handful of folks that still want to hold on to a past that ultimately continues to celebrate people's trauma.
Robert Patillo, your thoughts? Hold on, wait a minute. Chappelle wants to press record. Chappelle? Okay, now go.
Well, it's interesting because the argument around this has become so political all of a sudden, where the conservatives and others see this as being an example of woke, quote-unquote, cancel culture, trying to get rid of and tear down their history. Columbus Day wasn't a holiday until 1937. So it's not like this is one of those things going back to 1776. And even during that time, the reason it was a holiday in 1937, anybody want to think about what was going on around that time? It was about the time we were going to war with Italy in World War II. Part of the axis between Japan, Italy, and Germany in World War II, the Axis powers. So because of this, Italian Americans wanted to lessen the amount of discrimination, show that they were really Americans. So they start circulating this idea like, hey, man, look, we found this stuff. And that's where the kind of idea of Columbus discovering America really became prominent and how they were able to pass it into law. And if you notice, it was kind of a watershed moment because that's when you started seeing Italian Americans go from being a minority group to being assimilated into whiteness. They suddenly, them and the Irish, shortly after World War II, got basically elevated into whiteness. In the 18th and 19th centuries, Italians and Irish and other ethnic or white groups were seen as being only slightly better than Africans and Indigenous and Hispanics in America. There was very much discrimination. They lived in ghettos. We have all the great gangster movies from the 1930s showing the way that they were portrayed. You can look at the Notre Dame Fighting Irish, the idea of the Irish being drunk and fighting and so on and so forth. So this was mainly a PR thing for the Italian American community so that they can see themselves being more so incorporated into American society and ascending into whiteness. So it's not as if this is some sort of historically based fact. I think everybody understands that Columbus never made it to America. America's not named after him.
Wait. Everybody doesn't understand that. Don't roll over that. People think he landed in Florida. He didn't.
Yeah, I hope people understand that he did an island hopping campaign throughout the Caribbean, but I think the details of that island hopping campaign is what has been left out of much of this propaganda around Columbus Day. One of the first things he did when he met the indigenous peoples in Hispaniola, the island of Haiti, and in the Bahamas and throughout that region, is start enslaving them. When their soldiers landed, they raped, robbed, pillaged, killed the minute they saw a piece of gold. They kidnapped people and took them back to Europe to show what they had found. The way that they translated things back then, because it didn't have Duolingo or Babelfish or Rosetta Stone, they would kidnap somebody, take them back to Spain, and then teach them the language at the tip of a sword. And then when they came back, he would be able to translate between them and the other Taino and Arawak and Carib Indians of the natives of the area. And from there, he didn't understand that those islands were not rich in gold. They had some gold, but he thought they had just tons of it. So he basically mined and worked the people to death, trying to bring back the amount of gold to pay for the trip that he had. One of the interesting things about Columbus's first journey is one of his journals says that when he got to the islands, he found black people. They said they described them as more in color, and that they had gold-tipped spears, which leads to many people to believe these were the descendants of the voyage of Mansa Abu Bakari II of Mali, who left about 20 years before Mansa Musa took hold of the Malayan Empire. So many people believe that those are the descendants of those tribes who may have also been killed by Columbus during this expedition to the New World, which actually preceded Columbus by several decades. So I think once people understand the barbarity that you're celebrating on quote-unquote Columbus Day, that you're celebrating a holiday that led to the deaths and the disease of tens of thousands of people, the enslavement of women and children, the raping of an entire land, the future exploitation of an entire region of the world. And remember, the population of North America and Central America at the time was estimated to be nearly double that of Europe. they estimated there to be between 100 million and 200 million native peoples in North America and Central America at the time. And because of European disease and colonialism, that population was nearly wiped out in under a century. So this is why it was so easy for Europeans to colonize America, because the diseases they brought with them decimated the native populations, leaving them an empty country to walk into. So if you're waving your Columbus Day flag, I think there's to be more context to what you're putting out there, and maybe you should sit there and talk to some of the native peoples so they can explain to you exactly what they went through as a result of you being able to wave your flag on 1492 Columbus Day over ocean blue.
And that's the history lesson, everybody. Cannot wait to hear from you, Dwight McKee, your thoughts about this. And I want to hear everybody's thoughts and feelings. Ryan has called in from Juliet, Don from Chicago, and I want to hear your thoughts. 773-763-9278, 773-763-WCPT. Do you know that Christopher Columbus never even landed in the United States? Do you know that the holiday was established in 1937 and then fortified in 1971? Wow. I mean, this is all new, everybody. We act as if this has been going on for centuries. No. And how do you discover a place where people already live? How does that work? There's got to be another way to celebrate Italian-American contributions to the American project. Other than this, got to be another way. Not to mention the fact that, and thank you, Robert, for helping us to understand this journey into whiteness, because everybody gets ascended to whiteness except Black people in the United States, and that's its own story, which is what this is also about. So let's talk about this. What do you think about Columbus Day and Indigenous Day? President Biden became the first president in history to affirm to make this a federal holiday, but it's still Columbus Day too. He left that alone. Can't wait to hear your thoughts. Back with more of the Santita Jackson Show in just a minute. Okay, thank you all so much. Robert, total insult of our intelligence. And you said, I will never honor that evil genocider ever. All right. Everybody's feeling some kind of way about this. I can't wait to hear your thoughts. Please call in. Continue to call in at 773-763-9278, 773-763-9278. I'm going to put the number up. So you all continue to call in, and I promise you I'm going to get to you. Dwight McKee, you there?
I'm here.
All right. Well, we are going to get right to you. And you all can talk amongst yourselves. We're on Facebook Live right now. And so...
And thanks for that, Santita. I made the right decision, didn't I? The history lesson that was offered in that moment, and I really wish I could just take that and bring that to the committee meeting last week.
All you have to do is pull it from my podcast.
Listen, I'm working on it now.
Seriously, pull it from the podcast and tell them you got it from my podcast. How about that? Give me a little publicity. Yeah. Seriously, you should.
I appreciate that.
You should.
Well, I think it's actually disturbing that, you have adults who sit on a body of government that want to lecture young people about knowing the history.
Is that crazy? No. Tell them you're right. We should know the history. Roll tape. How about that?
Exactly.
No.
Thank you, Brother Robert.
No. So let them say, you're right. We do need to know the history. Let's talk about these rapes. Let's talk about eliminating 90% of a population of a people. Are you kidding me? Who does that? Who puts smallpox in a blanket and gives it to people? Who does that? Who puts smallpox in a blanket and you give it to people to sleep underneath? Are you kidding me? Brandon.
Well, Santita, one of the more brutal points of Spanish colonization of the New World, even beyond the conquistadors, was what they did in Chile. When they got to Chile, they actually found an entire mountain range made of silver. But the only way to process the silver was with some of the most disgusting and dangerous chemicals. I think the life expectancy for people working in those Chilean silver mines was something like 6 to 8 months. So they worked these people literally to death. They poisoned them to death to get the silver out. But they actually got so much silver out of those mountains that the dollar sign that you see now is actually the Spanish seal of arms, with the two columns going through the S for the Spanish king. That's how much money they got enough money to change the world economy, and they actually went into a recession because they depressed the price of silver by introducing so much, but killing so many Chileans. And you're not going to find that in the history book nowhere that we teach these kids while we're talking about the Spanish Empire.
And the indigenous people are poor.
They said,
What?
yeah.
Mark Fancher, you there?
Of,
Thank you, honey.
Yeah.
Oh, this is going to be fun.
Yeah. No, the population of Hispaniola went from 8 million to 28,000 over a span of 20 years after Columbus landed. 99% reduction in population in 20 years.
I mean, who does that? How do you do that? That's not something you celebrate. That's something you expose.
30 seconds.
You understand it and you apologize for it. You have to, everybody. This is just... We're not going to be able to move forward in a healthful way.
There are two school districts in my district.
No, hold on. I'm going to come to you, but I want to get to some of the callers too. But I want to bring on Dwight and Mark Fancher.
This is the Santita Jackson Show.
Determined, unstoppable, achieving the impossible. We're standing tall with our heads held high. We are victorious.
Wow, everybody. Welcome to the Santita Jackson Show. It's Monday, October 11th, 2021. Indigenous Peoples Day, Columbus Day. It's a holiday. It's a shared federal holiday. I want to know what your thinking is. Well, I'm coming to you from WCPT 820, the nation's largest progressive talk radio station at AM 950 Radio, the voice of progressive Minnesota. A lot of people feel all kinds of ways about this. Excuse me. And so I wanted to bring together a panel of people who could give us some context. Of course, we've just heard from Robert Patillo, Attorney Robert Patillo from Rainbow Push Coalition. He's Southeastern Regional Director, brilliant civil rights lawyer and radio host on WAOK every Sunday from 1 to 4 Eastern Standard Time. Another brilliant talk show host, union leader here. Now he's one of our Cook County Board Commissioners, the esteemed, honorable Brandon Johnson, who has brought this before the commission so that we can have it as a holiday, and he is getting pushed back. Wow, everybody. And of course, we have got Dwight McKee, Dr. D, founding member of Rainbow Push, of Operation Push, and of the National Action Network, and Attorney Mark Fancher. I cannot wait to hear what these guys have to say, and I promise you, Ryan and Don and everybody else, I'm going to come to you, but Dwight McKee, your thoughts?
Well, first, let me thank and commend the commissioner for his courage.
Yes.
And introducing the legislation for that. It's a lot of foresight and courage to do that. Let me say this to this holiday. I think it's very important to acknowledge Columbus. But I think there's a difference between acknowledging somebody and celebrating somebody. Mm-hmm. We acknowledge Judas, but we don't celebrate Judas. Judas is crucial to the Christ story. And so you have to tell, if you're going to tell a story about Christ, you have to acknowledge Judas as a player in the saga, but we don't celebrate the fact that he sold Jesus out for 30 pieces of silver and had him crucified. We acknowledge Hitler. We don't celebrate Hitler because Hitler killed millions and millions of people. You can't understand World War II without understanding Hitler. So he's part of the story, but we don't celebrate him because you only celebrate somebody, you only honor somebody based on the fact that they deserve to be honored. And Columbus is that same situation. I think we should acknowledge Columbus because him coming to these lands changed the course of history. And yet what he left in behind him in terms of genocide, the killing of a whole people, in terms of stealing the people's land, in terms of setting the tone for other people to be totally
wrongly enslaved for hundreds of years that had to be acknowledged. But I think it's hypocritical for us to talk about honoring him. There are other heroes that the Italians can find that has less baggage. I mean, we can honor Marconi. We can honor Joe DiMaggio. They've done some great things, but they don't choose Al Capone for us to honor him because of what he represents. I think that we should talk in great detail about Columbus and his legacy, but we should tell the whole truth. He was an explorer, but he was also a murderer and a rapist and a thief.
Mark Fancher, what are your thoughts? Of course, you are a brilliant civil libertarian and from the National Conference of Black Lawyers, and you've got your own book, and everybody, we urge you to get it. I just finished it. It is something fantastic. The Negroes of Friends Village. He's going to come back and talk with us about that. Mark, Indigenous Peoples Day, Columbus Day, you were sharing some information to us. Well, just you go for it.
Yes. Well, we're dealing with two different concepts. On the one hand, if we're talking about honoring Columbus, we, as Brother McKee explained so well, his legacy is one of horror, tragedy, blood, massacre. I mean, when he landed in Hispaniola, the indigenous population there of Taino people numbered about 8 million. After 20 years of enslavement, torture, and massacres, that population was reduced to 28,000.
Say that one more time. One more time.
Over the course of 20 years, the population decreased by 99% because of enslavement, torture, and mass killings. And, we have to understand that he really established something of a tradition, a way of viewing indigenous peoples that carried over into later parts of history in the Western world, especially here in North America. I mean, there were so many massacres that were committed against the First Nations. One of the most notorious was one that occurred at Sand Creek in Colorado, where a man named Lieutenant John Shivington led a battalion of cavalrymen into a village that was occupied at the time only by elders, women, and children. They killed them all. They scalped many of them. They carved the genitalia from many of the women, and they attached these as trophies to their uniforms and to their hats, which they wore proudly for a parade in Denver to celebrate their great quote-unquote victory. So we have to understand this legacy, and it is not one that is deserving of any type of a holiday. With respect to indigenous peoples, they certainly are deserving of some type of acknowledgement, particularly for those of us who are African people, because enslaved Africans many times escaped from plantations and found refuge and sanctuary among these communities. There were military alliances that were formed between escaped enslaved Africans and the Natchez Nation, the Choctaw, the Ottawa, the Mohegan, and the Seminoles. And these were battles that were fought shoulder to shoulder between black and indigenous peoples against U.S. troops. And in the case of the Seminole, they defeated them repeatedly and maintained control of Florida, what we now know as Florida, fighting them off. So, it's a great, great legacy there. But the question that I come back to, which I think is an important one, which is, we're talking about Indigenous Peoples Day. Has anybody bothered to ask them if that's what they want? Mm-hmm. I mean, if I were a First Nations person and somebody came to me and said, "Do you want a holiday?" my response would be, "No, I want my country back." So we have to be careful that we don't make presumptions and that we don't do things that don't necessarily meet the needs and the expectations of a population that has been brutally oppressed and dispossessed of territory that by all right is theirs.
Amen. And indeed, as we have not observed respected any of the treaties. I mean, the first one that we respected was in Oklahoma, 48% of the state. The land is supposed to go back to them. They're still trying to negotiate that. I mean, there is a lot going on, and our indigenous brothers and sisters dwell in poverty that is unimaginable to most Americans. They are a global south within the United States. I think they want a way out. I think that they want treaties to be observed. I think that they want a lot of things, but I don't, that doesn't matter what I think. It matters what they say. And to be, just to fully disclose, I asked some of my brothers and sisters from the indigenous community. I called them just a little bit too late. A couple of them, we've had Chief Hoskins, the chief of the Cherokee Nation. He's in a place where he was going to be out of contact, but they would have been with us today. But don't worry, we are going to be talking about this not just today, but moving into Thanksgiving. And just we're going to talk about this because this should be part of our conversation, everybody. It should be part of our conversation. Don, are you still there from Chicago? Is Don still there? Hey,
Yes,
Don, what's
hello?
on your mind?
Hey, let's talk about the Columbus Day. Me personally, I'm a mutt. I'm Irish, Italian, German, Bohemian, about 5, 6 different things in me.
You're a human being, Don.
Yeah. We were, when I was a kid, we were taught in school that, like you were saying earlier, Columbus didn't actually hit America. He hit the Caribbean islands, I guess, originally. So he didn't discover what we now call today United States. He discovered Caribbean.
No, he went there. He didn't discover it, right?
Right. He found it because it was already there, obviously. But
right.
So he discovered it for the Europeans. But he didn't find America, what we call America. He found the Caribbean because he missed. They didn't have GPS back then. Then we were taught. I learned that that began a lot of the colonialism from Europe to America. So all the colonies owned in America, and then all up and down, the coast, Central America, South America. And then the slave trade coming from Africa, about 96% of it went to South and Central America. Only 4% actually came up here to what we now call the United States. I have no problem if somebody says, you know what, personally, as part of Italian, I could care less that if we could stop calling it Columbus Day, because he doesn't represent all Italians, just like the mafia doesn't represent all Italians, and Italians were prejudiced against when my great-grandparents came here too. But that being said, I really don't need it. Tons of tragedy and torment, and you can go throughout the ages. I probably think you can hear stories about the Jews almost getting eliminated. In the Bible, they were enslaved by Egypt for years. Genghis Khan with the Japanese did the Chinese before World War II. They killed 400,000 in the city. There's tons of stories of tragedy throughout history. I think it's a lesson. We learn it, but it's history. We're not going to undo it today. We should just take pride in ourselves and the fact that our country started at a time when the world was so chaotic and there was slave trade all over. And many of our founding fathers, like Ben Franklin, he was actually an abolitionist. Many of our founding fathers didn't want slavery. The original 13 colonies fought against England to kick them out, basically for taxing us for money. And 95% of Americans never owned slaves, even when the country first started. It was only a small percent. The rich southern plantation owners owned most of them.
But it wasn't just in the South, though.
Our country as getting rid of this tragedy as a baby of a country. Keep in mind, most people back then only knew when they looked out their front door, they knew about a square mile around their house. Most people had no idea what was going on around the world. They're just, trying to make a living within a log cabin. And yet they got rid of this tragedy. Our early founding people of this country got rid of this tragedy of slavery faster in 94 years. And this is
No. Wait, Don, hold on. We were enslaved because we were enslaved for 250 years now. But please, Mark, go ahead.
You were enslaved, okay, but America, but United States.
But we were becoming America. But stay right there, Don. Don, I want you to stay right there because America is not that innocent here. It is not. Mark?
Let me suggest something. This is a line of thinking that exists in many places, and it is essentially this, that horrible things happened in the past. Terrible things happened in the past, but the people who are around today didn't do them. They're not responsible for those things. And so for that reason, we need to just move on. We need to just look ahead and move on and make the best of what we have. The problem with that is this. It is in many ways comparable to an individual who is walking down the street. He's approached by someone who's poorly dressed, and he's offered a diamond-studded necklace to purchase for a very small amount of money. The purchase is made, but somewhere in the back of the purchaser's mind is the thought, this is possibly stolen. This is possibly hot, and I've purchased it, but I'm not going to think about that. I didn't steal it. I'm not responsible for it. And so therefore, I bear no responsibility for the fact that I have this very expensive necklace that I was able to pay only a small amount for. What people understand intuitively, if not consciously, is that notwithstanding the fact that many people in living now were not directly involved in enslavement and massacres and all of those things, there is a derivative benefit that they enjoy as a result of that. Those processes established a social order. Those processes established an economic order. Those processes established a racial order that they continue to enjoy and they continue to benefit. And on some level, they have some doubts about it. They feel a little bit guilty about it, a little bit worried about it. But the response is not to look honestly at it and to say, what do we need to do in order to fix this situation? The response is to let's ignore it completely. Anybody trying to introduce these facts into the schools through the curriculum will brand it critical race theory and will say that this is making white children feel bad and therefore they should not be exposed to these ideas because it will make them feel bad. This is not about whether people feel bad or not. This is about historical justice. And in order to correct that justice, ultimately, a lot of things are going to have to be done in order to make a lot of people very uncomfortable. And not only in terms of how they feel, but in terms of their material conditions and in terms of their place within the social order. And so just as the individual who buys the hot necklace has a responsibility and an obligation to go to the police and to turn it in and to try and find the person who this was stolen from, the people who are the beneficiaries of a stolen hemisphere and the forced labor of countless numbers of kidnapped Africans have a responsibility to make that right as well.
Amen. To Ryan from Joliet. Ryan, what's on your mind?
Brian.
Oh, sorry, Brian. I apologize for that.
Brian, that's okay.
No. Thank you for the correction.
And I just wanted to say I've been a great admirer of the Reverend Jackson, your father. I voted for him in 84 and 88. My thoughts and prayers goes out to him and your mother.
Thank you. You're so kind. I appreciate that. From my heart to yours, sending you all of my love and the love of my family. Thank you. That's very, very generous.
Well, you're welcome, and I really mean that. And I wanted to say that, I'm all in favor of critical race theory. In fact, I went to public high school, and in 1972, I read "Bury My Heart at Wounded Knee." That's about Native Americans. Another book, 1989 book, Son of Morning Star, very important. Documentary by Bill Moyers, I think 1991. Bill Moyers, as all of his documentaries were wonderful. PBS, WTTW.com, people may still find it. Oren Lyons about the Iroquois, and 1975 film, if people don't want to read the book, about Chief Joseph and Nez Perce, I Shall Fight No More Forever. And I think people should read something about Tecumseh of the Shawnee, and to keep in mind that Native Americans were known to take into their tribes escaped slaves and welcome them into their tribes. And I think having any statue of Columbus up would be roughly the equivalent of people of Poland putting up a statue of that devil Adolf Hitler every September 1st. And I'd be all in favor of giving this country back to the Native Americans.
But Ryan, let me ask you this. And I hear you, but why do you think so many other people feel very, very differently and just as strongly as you do? What do you think that's about?
Why people feel differently from what I just said?
Because you have a. I mean, stay right here, Mr. Ryan. You're getting some pushback, Commissioner Johnson, from an African American who's one of your colleagues on the board, who's saying that some Native Americans enslaved Black people, and then you have some people who are saying that you're disparaging the Italian American community. Why don't you speak to that?
Yeah, what you mentioned was the plight of freedmen, and which the families that we are working with, the indigenous families that want to see Indigenous Peoples Day recognized in place of Christopher Columbus, have been very clear with my colleagues around fighting for freedmen. What we made also very clear is that there are powers that we possess at the county level that allow us to do certain things, and then there are some limitations to those powers. And so there's a strong commitment to continue to push the federal government to do right by freedmen. In fact, the new Interior Secretary, Secretary Holland, has made it very clear her own tribe has also recognized freedmen as a part of the indigenous history. As far as, the pushback that we're getting back, particularly from white America, it's actually very typical and standard. It's already been articulated that there is a graduation, if you will, of whiteness that many people want to continue to protect. But what is overwhelmingly convincing in this moment is not just the history of Christopher Columbus, but more importantly, the history of indigenous people in this hemisphere. The fact that I have two school districts in my district, the Chicago Public Schools, which I taught in, and Oak Park Public Schools, have changed the day to Indigenous Peoples Day. And so we have a contradiction in our government. We have a contradiction in our own calendar. And what I've expressed, with the Native and the 180 different organizations that have supported this measure, we've had hundreds, if not thousands of people testify in favor of it. In fact, the other side, Santita, that was speaking against us, one of their lead witnesses was the professor, Mary Graper, who does not believe in the 1619 Project. There are individuals that want to eradicate the truth from our history, and we have a responsibility in this moment not only to get the history right, but it will set us up to not just have further conversations, but to shift our policy so that our policies begin to reflect the values that we continue to promote, particularly for those of us in the progressive wing.
Robert Patillo, I only have a couple of minutes left here. What are your thoughts? Is Robert still there?
Well, it's one of those things where I think this is part of the way I describe white supremacy is as an infection, that it's something which is spread, which is communicable, and which often is passed down hereditarily by the way that we educate people and the way that we expose them in this country. But the only true cure to the disease that is white supremacy is education and love. And what we have to start doing is educating people, but we have to educate them through a place of love. I think when you kind of barge in, start tearing down their white statues, start tearing down their white monuments, they get so entrenched in their mind, they get into a fight or flight response. But I do think once we start speaking with people about this latent white supremacy that they're still suffering from, they can start recovering from the symptoms of it and start understanding that maybe we should not be worshiping people who killed hundreds of thousands of millions of people in the entire hemisphere just because it makes us feel good. Because since they're still infected with that white supremacy, they can't breathe right, they can't think right, they're running a fever. And we have to start vaccinating them against white supremacy if we want to stop this from continuing going forward. And that's only going to happen through educating them properly on what has historically happened.
Mark Fancher, the last minute belongs to you.
Well, and I think that the last word belongs to God, because we're really watching the unfolding of a long saga that ends in victory. Notwithstanding, and I like to remind people of this, notwithstanding all of the horrible things that have happened in the past, and many of the horrible things that are happening now, the fact is that we've made progress in terms of human understanding. The standards have changed. Whereas they could throw a parade for those who committed the Sand Creek Massacre back in the 1800s, you could never do that now because the standards have changed, the expectations have changed, and that represents an advance of humanity and ultimately the triumph of good over evil. So I'm hopeful in that respect.
Amen to that. You know, if you all would stay with me for a couple minutes after we get off the air here, I'm going to get some closing thoughts from you on the Santita Jackson Show, on my YouTube channel, on the Santita Jackson Show channel. You know what? And of course, those of you who are on the Santita Jackson and Friends page, I'll say this to you. Mark, you bring up a great point. I heard my Uncle Andy, Andrew Young, Ambassador Andrew Young, Reverend Andrew Young, say some years ago when asked by Ed Gordon, that brilliant journalist, and he had just lost his wife, his first wife, Miss Jean, and it was a struggle for him. You know, obviously losing someone with whom he had been through so much, and then knowing that with all that he had done in the civil rights movement, with all that he had lost, he said, you know, there's still so much to do. Do you have any regrets? He said, no, no, no. He said, you know, God has already won. I just want it to be said by God when I have that moment when I meet him that I did my part to make God's kingdom on earth a reality as it is in heaven. The victory has already been won, everybody. We're now watching a reordering. We're watching things get right, and it's uncomfortable. My father used to talk to me about growing pains when I was having my little teenage year fits. But you know, that lets me know that you're growing. We're growing, everybody. We're growing. And we're going to get right. And not just better, we're going to get right. Stay right here on the Santita Jackson Show. Can't wait to be with you tomorrow, God willing. God bless you, everybody. Happy Indigenous Peoples Day. Okay, you guys, you all can keep on going. Dwight, do you have anything you want to say? Boy, oh boy, I've got so many great people today. I don't even know what to do. You want to make my life easier. Dwight?
Yeah, I just want to make an amendment. Yeah, I just want to make an amendment to Mark's analysis. Is that they didn't buy a stolen bracelet one. They set up a pawn shop. They institutionalized their thievery. And so we can start having the Vatican send the gold back to the indigenous people that they stole from South America, and then have the Spanish send back all of those silver that they set their whole European economy around. They can send that back to the indigenous people. We can start there. It really is not that they was walking down the street and somebody came and sold them a bracelet. It's that they said,
Oh, Dwight? Hello? I think they might have done a changeover. Hold on a second, everybody. Hold on. Devin? Okay, hold on, everybody. Hold on. Devin had to do a changeover for another show. So just stay right there. Stay right there because I want to get your full. Okay, Dwight?
This morning, and if you all can still hear me, I want to thank you for your encouragement. I didn't really anticipate the type of visceral response, and I should have. And to the extent in which the county board is made up of 80, people of color that have all been impacted, by the policies and the mass genocide, right, and the rape and the enslavement. Our collective voices alone could have made this a holiday. And really, the goal is, it's why we made it very clear, Indigenous Peoples Day, Reconciliation Day, that the Native American groups that were supportive of this, and there were over 180 other groups that were supportive of this, literally thousands of emails came in over 100 to 1, if not greater, in terms of those in support. What it demonstrated, though, was the hyper concentration of where power is, and that the fact that people are still afraid of Christopher Columbus. And what I've expressed to my colleagues, you don't have to be scared of him anymore. We is free. So it's a fight that we have to continue. There's a press conference today that I'm headed to now, Santita, on the north side of Potawatomi Park. So folks want to meet us out there, 7340 North Rogers Park. There'll be folks out there celebrating Indigenous Peoples Day. That's what my kids are celebrating. That's what we're encouraging students all over Cook County to celebrate. Now we just need the body of government to actually catch up with the people.
Look, let me tell you something. Every January 15th of my life, we were not in school. Dr. King's birthday was a holiday for us before it became a national holiday. My parents did not wait on the government to honor Dr. King. That is what we did. My parents pulled us out of school. And Dwight, did we not have services for Dr. King? And you were not in school on that day. Right, Dwight? I'm telling you. It's every year. And we have to do that with Indigenous Peoples Day. And tell the truth. I think you have to give the information that all of you gave here today. I mean, my mother, she said, no, Columbus killed people. He genocided a whole race of people. Now, that's what I heard when I was 5 and 6 and 7 years of age, and I was not too young to hear it. My mother wanted me to know the truth. It is too hard to unwind a lie. You can't do that. You got to tell your children the truth. It does not diminish you. This does not diminish the Italian-American community. Please, Italy didn't even exist in 1492. He was from Genoa, a little tiny nation state, a little town, okay? And if anything, then find some new heroes. You don't need to honor people who behave so dishonorably. And you cannot pin your self-respect and your self-esteem on that. Too much of what we have exalted is that which is absolutely base and murderous. It's just not healthy. You got to change that around. I mean, like right away. So, I mean, I want you to consider that. And one day I'm gonna try and get you gentlemen together. I was gonna see if I can get any of you all tonight. But if I can't get you tonight, I certainly want to get you in the next few days to have this conversation, because I think it's important that we talked about that we talk about that we have the discussion that we've had today. Because it's so much. I mean, Mark, I can never thank you enough for your sense of history and always bending it back to God, because ultimately that's the key. Because God has already won. Now, what you're beginning to see is a reordering of, don't act like, that's why we got the problems with the mask, because we want things to return to normal. Do you really? Do you really want to return to all that poverty? Do you really? Do you really want to return to all that war? Do you really? Do you really want to return to all this corruption? All this mess is being uncovered right now. That's what's happening. I want things to be normal. Normal for whom? Are you kidding me? They were taking bets on people who worked on the assembly line who was going to get COVID. Are you serious? That was normal. Last year, that was normal. We don't need to return to that. What should be normalized is universal access to equal high quality health care and education and housing. That should be normalized. And we're not going to get out of this pandemic until we wake up, grow up, and decide that is something that everybody deserves, that we need to create a floor beneath which no human being should fall. And you're right, Dwight. Don't remove Christopher Columbus. You need to know who this man was and who his compatriots were. You need to know what they did so that we do not do this again. You need to understand what happened. How do you eliminate 99% of a people? How do you do that? And you don't want to discuss it? Oh no. The ancestors cry out, and they will be heard. You can't do that. You can't put smallpox in blankets and give them to people. Are you serious? You think you're not going to pay for that? Come on, everybody. Let's grow up in our politics and grow up in the way we treat people and regard people. Come on. Come on. Who else is still here with me? I want you to have your final say before we go.
And then you wonder why people want to take the smallpox vaccination.
Oh.
That's why they want that to be told, is because the implications that goes through. That the history is sometimes a precursor to the present and the future. And so the reason that these people are so anti-truth is that they don't want us to understand what has happened historically, so they can continue to manipulate and control and be in charge. I always say that Jesus said the truth will set you free. So people don't want you to know the truth. It's because the people don't want you to be free. They want to keep these lies going so they can maintain control and maintain and manipulate. And that's why I said, Mark, this is not a stolen bracelet. This is a fencing operation where they live and maintain their living by fencing stolen goods and selling them on the hot market. This is a pawn shop. This is the whole economy is built around the selling and leasing of stolen goods from people who are still alive, who they see no responsibility to return those goods to. So let's start by having the Vatican send all of the gold back to the indigenous people that they stole from. They have tons and tons and tons of gold in the Vatican today, in the Vatican archives today, that they stole from these people. The Spanish have tons and tons and tons of silver that they stole from these people. The British have tons and tons and tons of gold that they stole from these people. We need to return that to these people as a start to make it right.
You know, would someone speak to Paula Garcini Zipser? She is one of my original Morning Stars. This is my dear, dear sister. And she was saying that as an Italian American, she feels pained by this. What do you say to Paula?
Well, I would say it's less important to... Oh, go ahead. Go ahead first.
No, go ahead, Robert.
Well, I would say instead of feeling pained, to work towards amelioration. You weren't the person who did it, but you can be the person who helps to fix it. So when we're talking about these city and county ordinances to overturn, to turn Columbus Day into Indigenous Peoples Day, get out there and advocate. Fight for those people. Make sure that people understand the true facts and the true history. And I find it hilarious that we always talk about why Europeans exploring the New World, but never talk about why they were exploring the New World. Why did they find the need to go across the ocean? And the reason is that after the fall of the Roman Empire, Europe was basically a third world hellscape. Warring tribes and warring factions, they wiped out many of the forests in Central Europe, and they could not get to trade routes to the east because of the Ottoman Empire, of course, right there in, where Turkey is today and throughout the North African Peninsula. Also, you had the Berber traders, you had Libyan and Carthaginian pirates and so on and so forth. So they were kind of boxed in. So it's easier for them to sail all the way around the world than it was to just to try to fight or trade with those people who were next to them. And I think it says a lot that they pick up the story at the moment of European triumph, but they do not talk about the devastation in Europe that took place before that vitiated it. So what we're talking about is creating a full history, a full tapestry, a full color. Not in right now we're seeing history with the little black and white TV with the bunny ears on it with some static. We got to get this thing in 4K Ultra HD on a 50-inch plasma screen so people understand exactly what happened, and you can start being part of that solution by expanding out the vision and talking to people and helping them to understand and helping to change policy around it.
Mark?
Yeah, the way they just, if I say real quick to his point, the way they explain that, Robert, is they just put all of it in a big old ball about 1,000 years and call it the Dark Ages. They have no discussions about it, no interpretation. What does this mean? They say, well, there was a Roman Empire. It crashed in the 5th century, and then in
14th century, there was a Renaissance, and everything in between it, there was the Dark Ages. This ossification and this neglect of history has been going on for a long time. They only want to talk about the good, and they want to put a cover on the bad. The Dark Ages. Let's look at what the Dark Ages were and how that operated.
Mark,
I'm sorry.
Yes, I was going to echo everything that was said, but I think that it's really always interesting to me, especially in white communities, how there is this desperate flight from historical truth, and this insistence that we just move on, that we go from here and just move on. Perhaps we should do that. But overcome within those communities this preoccupation, this obsession with feeling good about these communities and their past. It was terrible. Own it. Feel bad about it, but feel good about the future. Let's move on. I mean, there remains always the possibility to do better. And the fact that there are, ugly aspects of our history does not mean that there can't be a bright future. And it is something that has been part of, Western European white culture from the very beginning. The whole notion of white supremacy was born because of this preoccupation with feeling good about what they were doing. They did not feel good about conquering lands. They did not feel good about enslaving people. They did not feel good about oppression and exploitation. They didn't feel good about it. So in order to make them feel good about it, they created an entire doctrine which helped them to accept on some level that what they were doing was something that was benevolent and charitable, because all of these other dark-skinned people around the world were inferior, savage, uncivilized, heathens, and that they were saving all of these people. So, to the extent that there was enough conscience among these communities to at least drive them to that point, to make them have to develop mechanisms and devices for, feeling fine with what they were doing morally, that gives some hope that at least conscience is still there on some level. And the objective should be to fan those embers to make conscience blaze up into a full flame so that we can move forward and do real justice to the people who have been the victims of these historical crimes.
amen to that. Let me ask you, gentlemen, and it's whatever answer you give me is perfectly fine. I'm getting a lot of feedback. I mean, not audio feedback, but good feedback. Would any of you have time to be on the air tonight at 6 a.m. Central, 6 p.m. Central, 7 p.m. Eastern for about 45 minutes to talk about this?
Santita, this is Brandon. I can figure that out if the rest of the crew is available. I'm not doing it without Mark and Robert, though, and brother McGee.
We have a check for the conference tonight, but I can try to hop on.
Okay, that would be great.
Yeah, I'll try to. My choice has already been made.
Okay, Mark?
I'm a possible. It depends upon whether an existing conflict stays a conflict. It may go away.
Let me know. Let me know, because I want to get this same group together, okay? Because it's important, and we're going to be tracking this story, Commissioner Johnson, because we want to be supportive. And we also want to give you information. We want to give people information. So point people back to the podcast so they can listen to this, and also point them to my YouTube channel. I'll send you the links so that they can hear even this part of the conversation, because I think it's very important. The more that people know, the more that people can grow and we can move forward. I mean, that's why I want, and Paula, I hear you. Paula thanked me for acknowledging her. This is not about burying anyone or hurting anyone. This is about the truth. And the truth can be painful. And it is what it is. But you know what's even more painful and more devastating is the lie. And we need to stop telling the lies. You need to stop building your self-esteem and your self-worth on a lie. A lot of people have been hurt. My grandma Helen, who died in 2015, she was 92, 91, 92. 40 years ago, she wouldn't look at roots. She said, do you know why we look the way that we do? She said, do you think I want to revisit that? Don't you ever mention that to me. Dwight McKee, you knew my grandma Helen, my mama Helen. That happened to me in 1979. I never forgot that. I never forgot that. And the older I got, the more profoundly it impacted me, Mark and Brandon and Robert. Because I said, wow, you know, think of what our foreparents went through. And my father's from the part of South Carolina where if you look at him, you see it. You see the Native American, the African, and the European come together because they had a different kind of experience. But it's all part of the American experience. It's all part of the human experience. It's all part of the American. When I mean American, I mean not just USA. Because we're all over here on some European project, everybody except the indigenous people. You've got to acknowledge the indigenous people. They're the first people who were injured in this process. They're the first. That has to be acknowledged. Nobody has clean hands here, but you've got to acknowledge what's happened to them. You must. And we're not going to be right until we do. You must find these tens of thousands of babies who were buried while they were trying to be assimilated, while white people were trying to assimilate them into whiteness. And you have to call it what it is. Find these babies, not just in Canada, but in the United States. America's been very silent about what they did in Canada, what we did here. Pull these indigenous babies from their families so we could make them white. Well, you know what? I'm so glad about the one-drop rule. I'm glad that couldn't happen to black people, so we'd be crazy. How about that? So glad that one drop kept you in this project so we can make this thing right. Got to make it right. Happy Indigenous Peoples Day. Does anyone else have anything else they'd like to say?
Hey, Santita, just really quick, this is Brandon and to Paula. You know, one of the reasons why it was important for me to introduce Indigenous Peoples Day and Reconciliation Day for the very pain and hurt that she is describing in this moment, that one character individuals could worship and the other individuals see this as a symbol of terror and rape and genocide. And the whole purpose of Reconciliation Day was not just to lift up, to your point, the initial tip of the spear of the hurt and the harm that was done against Indigenous people. But Indigenous people here in Cook County were willing to recognize other people groups that have contributed to this experiment here in America, and also acknowledging that they experienced discrimination along the way. So this is actually a resolution and legislation that ultimately can bring people together, and that's my hope and goal. Thanks, Santita. I appreciate all the brothers as well.
We appreciate the work that you're doing. We really do, and we support you. We appreciate the work that you're doing. Understand the pushback. We get it. But we want you to know how much we appreciate you and how much we support you. And we have to continue to talk about this. We have to continue to talk about this issue and other issues. We have to continue to keep this forward. We're not going to be right as a people, as an American people, as a human people, as a race of people, as the human race, until we acknowledge the wrongs that have been done to people. You can't do it. Just any relationship. You know, if you are with your partner, your husband, your wife, your boyfriend, your girlfriend, when someone has been out of order, you got to acknowledge it. Otherwise, the relationship, it just doesn't, it stops working. Stops. So, and Laura, you're right. We need the truth, no matter how much it hurts. And then pour that peroxide in it, put the alcohol in it, out, clean it out, stitch it up, and then let it heal. But you're not going to get right until you acknowledge all of this pain. You can't kill 99% of people and say, oh, well, we've done that. Well, you know, we're going to go past that. No, you can't do that. You must acknowledge that Christopher Columbus never even came here. He never even got to Florida, and he was lost. Just acknowledge that. You want to acknowledge a lost explorer? Be my guest. That's the craziest thing I've ever heard. But you need to acknowledge who he was and what he did. And what Queen Isabella, what he did in her name, because it was all right with her. She paid for it. All these kings and queens from Europe. Elizabeth I and now. They make money off of all these people of color. 95% of the Commonwealth nations in the UK Commonwealth now are African and East Indian. So I'm sitting up here watching CNN, watching, oh my goodness, Diana. And I think she was wonderful. But she also supported monarchy. She just wanted to put a nicer face on it. I'm not with that. So much for that. And while y'all want to be princesses and kings and queens and dukes and duchesses, God bless you. I am not with that. Okay? That's it. I'm just telling you. I just have to put it there. So does anyone else have anything else to say? Mark, let me know as soon as you can what your schedule is looking like, because, tonight will depend upon you. But if we can't do it tonight, we're going to do it in the next few nights, because I think a lot of people want to hear about this. It's very, very important.
Okay, I will do.
Okay.
If you want to just plan to go forward, well, I'll just let you know as soon as I can.
Yeah, no, because
to hear from
you're
someone.
crucial to this. Everybody loved this particular panel, and that's important. That's important. That's important. Okay. It's not. You shouldn't feel pressured because I'm asking you at the last minute. Everybody's got, their life schedule. If we can't do it tonight, we're going to do it. We're going to reassemble this panel. We'll probably have to wait until next week because Robert's on. He's crunched because he's got a conference that he's putting on the 14th and the 15th. So, but this is one of these evergreen issues, and we need to talk about this. We need to talk about this, okay?
Well,
so just let me know.
Back, I'll shoot you a note.
Okay, thank you so much.
Okay.
I'm sending
Right.
sending you much love, everybody. Everybody. I was telling everyone to get your book, and I want you to come on and talk about that, because it really is, it's a great, 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 great book. It really is.
Anytime.
Oh, absolutely. Absolutely. I love you, everybody. Love you, Dwight. Love you, Robert. Love you, Commissioner Johnson. Who else? Did I miss anybody? Said Dwight, Commissioner Johnson, Mark. Okay.
Robert Patillo.
Robert Patillo. I thought I said Robert. Okay, Robert, I love you. I love everybody. And I love all my morning stars. Love you all, love you all, love you all. And Paula said she wants all of you back too. So there it is. It's a wrap. Okay, I love you, everybody. See you tomorrow, God willing, on the Santita Jackson Show. Thank you so much. Robert, I'll see you again tomorrow morning because we have to continue to push this conference. Everybody, the Creating Opportunity Conference. Robert, where do they go to get registered for that or to be a part of that? And it's free, it's virtual. Go to rainbowpush.org, and Rainbow Push Atlanta is putting on the conference. Go on and get there. It's free and it's going to be fantastic. You don't want to miss it. I love you, everybody. See you tomorrow.